There are many ways that many researchers have defined childhood trauma, and most of those ways are predicated on specific events. Verbal abuse, physical abuse, sexual abuse, complex trauma, meaning it happened more than once. That's a category we often see in the literature. Neglect, community trauma, worldwide pandemics. These are all attempts to categorize as sources of stress and trauma. But to a neuropsychologist, we look at it a little differently. Yes, those events are important, but trauma is how the nervous system becomes sensitized. There's a physiological component to trauma. Our nervous system becomes sensitized, and coupled with a psychological component to trauma, in that we begin to fear the fear. When our nervous system becomes sensitized, our body will react where our heart is beating out of our chest. We can't possibly get enough oxygen into our lungs. Blood is rushing to our extremities. We're in fight-flight mode. It's very difficult to sit still. It's very difficult to be in a conducive state for learning. These are all things that our body is doing as we become sensitized. But psychologically, it impacts us because we recognize sometimes we have these reactions in what seems like a safe environment. We call this a panic attack. We fear the fear. We fear our body may lose control in situations where it probably really shouldn't. And it's that sensitization, both psychologically and physiologically, that from a neuropsychological perspective, no matter where the source, now we have trauma.